You need a transplant. Those are the words nobody ever wants to hear from their doctor, but for many, that is a reality. Luckily, though, in our area, we have some of the best world class physicians and hospitals right here in the Louisville area. UofL Hospital is home to some of the best transplant doctors in the country. Joining me right now is Dr. Loretta Jophlin. Thank you so much for joining us, Dr. Jophlin. First of all, tell us about your practice and the kind of care you provide.
I'm a transplant hepatologist, as well as a general hepatologist and a gastroenterologist. So I help people with all types of liver disease, ranging from mildly abnormal liver function tests that are found on routine labs, all the way to decompensated or unstable cirrhosis in individuals who need a transplant or have already had a transplant. Here at U of L, we have a comprehensive liver disease center where we care for all individuals with a multidisciplinary team, including nurses, pharmacists, social workers, mental health workers. We also have a liver disease research center that has been going strong for decades, where we have clinical trials that are available to patients who may not have access to that at other places. So we can take care of anybody who has liver disease, and we want to be the trusted partners of individuals in the region who are suffering from any kind of problem with their liver.
And sometimes, as you mentioned, people come to you because they have liver damage due to alcohol or substance abuse. Talk a little bit about the stigma of alcohol and how it can relate to disease impacting these patients and their ability to get a liver transplant.
I'm glad you asked that. This is something I'm extremely passionate about, and I'm very excited that we are starting to break down these stigmas and open doors for individuals who may have liver disease from alcohol or substance abuse problems. This is a nationwide trend to transplant individuals who do have alcohol liver disease, even in the setting of relatively recent drinking. There used to be a rule called the 6-month rule, where people needed to have 6 months of sobriety under their belt in order to be considered for a liver transplant. And the sad fact is that there are some people who just don't have 6 months to live in order to meet that requirement. And so there are many transplant programs around the country that are now transplanting individuals who don't have alcohol treatment prior to transplant. We can transplant and then treat for alcohol use disorder after transplant. Breaking down the stigma of alcoholism, we don't even use that word anymore. It's alcohol use disorder. We are all individuals. Some people use alcohol, some people don't, but there's no reason to feel guilt and shame about it. This is a legal substance that a lot of people use to cope, and so we have to approach this with empathy and understanding and grace, and make sure that people don't feel shamed and don't feel embarrassed about this, because we really can help.
You're absolutely right. And it's such an important discussion. Something else that is so important that's impacting everything right now is COVID-19. And how has that affected your patient population and your recommendation for vaccines with maybe people coming in?
That's a very good question. Individuals who have known liver disease, we are learning that COVID impacts them in a very negative way. People who have liver cancer or cirrhosis have a 3 to 7-fold increased risk of dying of COVID. In regards to the vaccine, I feel strongly that all individuals who can be vaccinated, they don't have a strict allergy to the vaccine, should be vaccinated. Any vaccine that is available right now, and there's going to be more that are rolling out, appear to be safe and effective. For our pre-transplant patients that are on the wait list, and for those who have already been transplanted, we have very specific recommendations about which vaccine to get. We are recommending the Pfizer and Moderna mRNA vaccine, and we've sent letters to all of our patients. But for anybody else in the population, I feel any vaccine that is available, they should go ahead and try to receive it as soon as it's available to them.
Dr. Jophlin, such an important discussion. Thank you so much for taking the time today. If people have questions or you would like to learn a little bit more, ask those honest questions. All you have to do is go to 502, call 502 587 4939.